Maybe there's nothing more disconcerting than sensing weird transformations occurring within your own physique, especially when these shifts foreshadow the foreboding indications of an imminent stroke. However, fret not. You need not confront this journey in solitude. We've delved deep into this subject and stand ready to assist you in recognizing these indicators, a significant 30 days before a potential stroke may occur. Step into a video brimming with revelations about the 9 warning signs of a stroke, the extraordinary cues that will be unveiled right here. Sometimes, our busy lives can make it hard to hear what our bodies are trying to tell us. That's why we suggest you pause, listen to your body, and get to know these signals. Take the time to notice the early signs you might see a month before a stroke. It's not just about keeping everyone healthy, it's a caring way to take care of yourself. Don't miss the opportunity to learn about these signs and take a step towards better well-being. Let's embark on this exploration and share the video so that everyone in our circles can grasp these invaluable signs and maintain a life of well-being and joy. 1. Elevated blood pressure. High blood pressure, frequently labeled as hypertension, stands out as the most crucial known risk factor for a stroke. Picture blood pressure as a gauge of the force exerted by your blood as it gently presses against the walls of your arteries during its journey throughout your body, guided by your heart's rhythmic beats. Typically, we gauge blood pressure around 120/80, but if those figures consistently surpass 140/90, it signals high blood pressure. This condition isn't merely about numerical values. Rather, it serves as a subtle reminder that our blood vessels, including those connected to our brain, necessitate the heart to exert extra effort to maintain the circulation. Let's delve into how high blood pressure and strokes are somewhat like old acquaintances, but not in a favorable manner. High blood pressure weakens vessel walls and can spur on common heart issues. Additionally, it can prompt the detachment of tiny clots or plaques, potentially obstructing blood flow to the brain. Undoubtedly undesirable news. Keep in mind that the higher the blood pressure, the greater the stroke risk, prompting a call to action to check those numbers frequently. Now, why does high blood pressure manifest in our lives? It's a bit of a complex scenario. It doesn't typically stem from a singular cause, but rather results from a combination of factors. Elements such as family history, advancing age, and lifestyle factors like weight, alcohol consumption, smoking, diabetes, and even our occasional affinity for a salty diet all contribute. But fear not, as we possess some control over this situation. Vigilantly monitoring and managing blood pressure is paramount. Regular discussions with your healthcare provider to track those numbers serve as a health-conscious check-in. And here's the good news. Lifestyle modifications play a significant role too. Incorporating regular exercise and maintaining a healthy weight can work wonders for your blood pressure. 2. Fatigue. Fatigue, the sensation of persistent weariness, can surprisingly serve as a subtle indication that a stroke might be on the horizon. It's akin to a muted signal that warrants a closer examination. Delving into the intricacies, we uncover some intriguing connections. Exhaustion extends beyond mere tiredness. It's akin to your body's way of signaling that something might be awry. And here's the revelation. Insufficient sleep plays a pivotal role, imposing additional strain on your body's delicate equilibrium. Stress emerges as another character in this narrative, silently impacting your overall well-being. Adding a layer of complexity, an imbalanced diet can take center stage, disrupting your body's equilibrium and potentially elevating the likelihood of a stroke. 3. Visual disturbances. Visual challenges can provide significant clues about potential strokes, acting as the body's signal that blood flow to the brain may be encountering hurdles. In the realm of vision issues, There's a spectrum of commonplace concerns that merit our attention: blurriness, double vision, or the occurrence of partial or complete loss of vision in one or both eyes, constitute integral components of this warning system. Consider these as subtle hints that our body is offering, indicating a need for closer consideration. 4. Unexpected headaches. Those unexpected, intense headaches? They serve as the body's signal, especially if accompanied by additional symptoms. Headaches manifest in diverse forms and sizes, each with its own origins. Tension, migraines, and the classic sinusitis, all integral members of the headache family. However, here's the crucial aspect. Concerning severe headaches and strokes, there exists a connection that merits attention. When your head is throbbing and other symptoms linger, it's akin to your body transmitting a coded message. By assembling these puzzle pieces swiftly, we can potentially mitigate the risk of a stroke. Let's accord these signals the attention they warrant and stay on the path of health. 5. Loss of sensation or muscle strength. Experiencing numbness or weakness in your face, arms, or legs isn't a fleeting sensation, especially in the context of strokes. Let's unravel the potential reasons behind these sensations. Pinched nerves, arthritis, and even carpal tunnel syndrome. They serve as the typical culprits for causing numbness or weakness. However, when it comes to numbness or weakness in relation to strokes, there exists a crucial connection that requires understanding. Consider it as your body disseminating clues that demand our attention. If you observe these sensations, particularly if they align with other signs, it's akin to a call prompting proactive measures. 6. Difficulty speaking. Having a hard time speaking when it comes to strokes is a serious thing. It's like your body telling you there might be something going on with your brain. If you stutter, slur your words, or can't find the right words, it's like your brain and tongue trying to work together. Understanding that speech problems could mean there's a risk of a stroke is important. Think of it as your body sending messages that we need to pay attention to. If you're dealing with these challenges, especially if they come with other warning signs, it's like a gentle push to do something about it. 7. Memory troubles. Having trouble remembering things clearly is something many people associate with getting older. But recent research suggests that memory loss might be a sign that a stroke could happen. A study by Erasmus University Rotterdam looked into how memory lapses might show other health problems. The study, published in the journal Stroke, found a connection between memory loss and a higher risk of stroke, especially in people with more education. While earlier research suggested that strokes could lead to memory problems, this study looked at whether having trouble thinking could be a sign that a stroke might happen. The results showed that people with more education who had memory lapses had a 39% higher chance of having a stroke. This group included people with college degrees or similar advanced education. 8. Loss of equilibrium. Having trouble keeping your balance can be a sign of a potential stroke. This is because it suggests there might be damage to the brain's coordination center. The coordination center in the brain is responsible for making sure different signals from our senses and movements work together smoothly. When this center is not working well, it can make you feel unsteady and affect your balance. Several things can cause a loss of balance, like problems with the inner ear, weakness in your muscles, or side effects from medications. Inner ear problems, such as issues with balance signals, can directly affect how balanced you feel. Muscle weakness, often linked to different health problems, can make it hard for your body to stay stable and respond to changes in position. Also, certain medications can have side effects that affect your balance, like feeling dizzy, sleepy, or changes in blood pressure. It's important to know that these causes are not separate. They can work together and make the risk of losing balance even higher. 9. Nausea and vomiting. Feeling nauseous and throwing up can be signs that a stroke might happen. This is mainly because they're linked to a disruption in blood flow to the brain. The brain needs a steady supply of oxygen and nutrients carried by the bloodstream. In a stroke, when this blood flow is disrupted, it can cause various neurological symptoms, including nausea and vomiting. Nausea and vomiting happen because the brain reacts to the changes in blood flow and how it affects its functions. The brain usually controls bodily functions, including digestion, but when its blood supply is affected, this control can get messed up. The body might react with nausea and vomiting as the brain tries to get things back in balance. Different things can cause nausea and vomiting, so it's essential to think about what might be causing it, especially in the context of a stroke. While feeling sick and throwing up can indicate a possible stroke, they're not the only signs, and can also happen because of other reasons. For example, eating something bad can irritate the stomach and cause these symptoms. Viral infections, especially in the stomach, can lead to similar reactions as the body tries to get rid of the invaders. Feeling sick during travel, known as motion sickness, can also make you throw up due to mixed signals between your eyes and inner ear. Right now, there's no solid proof suggesting there are clear signs months before a stroke happens. But there are many factors that significantly raise the chance of having a stroke, such as high blood pressure, smoking, diabetes, high cholesterol, and heart issues. Being watchful about these factors and adopting a healthy lifestyle is crucial to lower the risk of experiencing a stroke. In cases where sudden and severe symptoms occur, like trouble speaking, sudden numbness or weakness in the face, arms or legs, or a severe headache, getting prompt medical help is crucial. These signs could mean a stroke is starting, and quick medical action is needed. Thanks for watching our informational video. If you found it useful, please share it with your friends and family so they can learn about preventing strokes. Don't forget to like and subscribe to our channel to get the latest health and nutrition videos. Wishing you good health, safety, success, and happiness, as always.